one of the basic things that we can use, and we use all the time in rehab, is massage. Massage therapy is something that, as a pet owner, you can actually do at home. It's great for bonding with your pet. It certainly does just more than that, as far as warming up tissues and releasing endorphins, and it's just a feel-good thing. Everybody's had a massage. So one of our first things we do with Duke is we do all 4 limb massages when he's in, and he loves this one. I mean, you can see how he just kind of enjoys the whole thing. Even though his problem is in his elbows, just because he's been having so much trouble with this front elbow, he's been transferring the weight over to the other limbs, and he's been having problems with the other limbs because of it. He also has some problems also in the back legs too, we'll talk. But anyway, so we start with a general body massage, as you can see, right? Pretty comfortable. Wake up there, Dookie. And then we'll go down to a specific area. Today we're going to be working on the front end and the back legs. So as a massage, we want to kind of get into isolate some of the muscle groups. There's different types of massages. We're not going to get into that today, whether it's a petrissage or effleurage. We're not going to be doing that on this video. Stay tuned for some of our other videos, and we'll probably talk about that. But gently just warming up the tissues and just massaging. We're also feeling at the same time. We're feeling to see if there are any abnormalities. So massage is really a good way to tell if there's a new problem or if that problem's going away. All right. Once we've gone through the general soft massage, we might get a little bit deeper tissue massage. Again, we're not going to go into the differences of what that's for and why in this video. We're also going to be looking at range of motion. So range of motion, again, another tool that we use to kind of treat these chronic arthritic patients. Range of motion just basically means taking the joint through a range of flexion and extension. It's full range, or at least whatever range, capable range, I should say, each patient would have. And we'd like to increase that. One of the problems with Duke when I first met him was that he had so much arthritic changes, his joint capsule became so tight that he would not even bend his leg. So we started working with massage and range of motion, and we're basically now almost back to normal range of motion. That's his elbow joint here. We don't just focus on that, we'll do all the joints. So even from the digits, we'll do extension. Extension meaning taking the angle of the joint wider, flexion of the, meaning closing that joint or making it smaller. So for instance, if we talk about the wrist or the carpal joint, flexion would be bending it inwards, right, to make that angle smaller. Extension would be bending it outwards, make that angle bigger. Okay? We go through that with all the different joints. While I'm working here, Jamie's also working on the same aspect behind me here on the back leg. So she did a bit of massage, and now she's working on range of motion of all the joints. When we do that, we try to isolate just that joint alone. Some people do full range where they'll take the whole leg and go through all the joints. I like to start with individual joints where we're doing the toe joints here, and then we'll do the carpal joints or the wrist joints without being too medically detailed. The wrist joints, we'll do the elbow joints, right? And then obviously we'll do the shoulders, right? I don't know if it's painful. I think that's the one. So as you can see, yeah, he's stiff today. That's a new finding for us. I'm going to take a little bit more look at that knee back here. Mom did say, although he's been doing great today, he came in. She mentioned a little bit more of a lameness on the right hind, totally different area, but that's what happens with rehab. We're not just evaluating the area, we're evaluating the whole arm. So thanks for watching this. We'll see you at our next video.